Environ Life Science Limited, partnering for life.
Hello everybody, I am Dr. Anshuman Manaswi, Director of Mumbai Lymphedema Center and a Senior Plastic Surgeon. Today we are going to discuss about a very complex but very prevalent topic called lymphedema. You must have heard of it or you may not have heard of it, but this is a very common problem. When I tell you about it, you will identify with it. You would have seen many patients with swollen leg just like elephant, and these patients are the one which we are talking about. This is also called as elephantiasis or hathi pair, hathi paw or hathi hath. In the eastern region it is called as or filariasis. This is a very complex disease, and the prevalence is almost around 20 to 30 lakhs of people in India who suffer from it. That is the magnitude of the problem. Worldwide, there's a lot of endemic zone. There's a huge loss to the economy and to the patient per se, who has a lot of morbidity because of this disease. Imagine carrying 20-30 kgs of weight of the leg and living with it. Till a few years back, there was hardly a cure for it. I'm proud to say that India has risen up to the occasion and we have a cure for lymphedema. We are doing work which is at par with the international level. And these developments have happened only in the last few years. Till now, the treatment, which was rightly so, was based on compression therapy, in which high pressure was given to the leg by means of massage and stockings or lymphatic pump. But beyond that, there was nothing. And these patients were very prone to infection, and thus repeatedly there would be infection and pus pouring out, and there would be skin changes. Plastic surgeons would come into play for removing a dead skin or a wound cover, but most of the doctors used to shun away from this disease. This was a disease which the doctors did not want to entertain because simply they didn't have a solution. Today we have a cure and we are doing a very good work. The surgeries of this disease of lymphedema deals with diverting the lymph fluid to other parts of the body. Before we do that, let me explain you what is lymph and what is lymphatic system. We know that in the body there is a blood flow which happens from the heart through arteries and goes back to the heart by the means of veins, and these veins carry the oxygen which has been used by the tissue and is carried through the red blood cells, and there are other particles as well which are there in the blood. But there are a lot of particles which are unable to be carried by the blood, like proteins, like other bacteria, germs which are there in the tissue. They also need to be filtered. So there is a parallel system just like veins and arteries which flows in the body, and this carries much larger volume of fluid transport. So we know how important it is. And imagine there is a blockage in that system. That is what happens in lymphedema. The fluid which is carried in these channels are called lymph, and once they get obstructed, the fluid accumulates in the tissues of the leg or the hand. It is something like there are a series of pipes through which the fluid goes, and it goes to the glands. We all have seen glands in our groins, in the axilla or in the neck. These actually filter the lymph of the bacteria, and so it's a very protective kind of a system. And then from the lymph node, again the fluid goes up and up through various levels of lymph node, finally to the veins in the neck. But if there is an obstruction, it may be temporary or permanent. But if the obstruction is permanent, the fluid will not drain out. With pressure, compression dressings, pumps, there is some amount of reduction, but a cure never happens. Over last few years, a cure has come into place by means of super microvascular surgery or super lymphatic surgery called lymphovenous bypass, in which the obstructed lymphatics are drained into the vein. So we bypass the whole obstructed portion and drain, just like if there is a traffic jam, you take alternate pathway to bypass and go through the side roads in case the main road is blocked. These surgeries are been revolutionary and are very fine surgeries, involves microscope of very high definition, but the early cases do get cured. We can do multiple such bypasses, and we help relieve the swelling by diverting those fluids through the circulation. The other surgery which has come into place is transferring of lymph node and lymphatic system from other parts of the body. They are also being used with quite a bit of success. But it is also important to understand why this happens and what precautions you can take. The commonest cause of lymphedema is a mosquito bite of a mosquito which is very prevalent in the coastal regions and in the Bihar, Odisha, Uttar Pradesh belt. These mosquitoes bite, they take the filarial worm, which is a parasite, and deposit it in the tissues in which they breed, and the favorite place of their breeding is the lymphatic system, which provides a very rich environment for their breeding, and they grow over there and they live over there in a very peaceful manner, which means that they stay over there and obstruct the lymphatics, and also called various reactions over there by which the lymphatics get blocked, and once they get blocked, we have this swelling called lymphedema. So what we can do is to prevent the mosquito bite, and the best way to prevent mosquito bite is not the coils and the other means, they are the mosquito net. We must use mosquito net at home and wear full sleeves in the enzymic zone, full sleeves shirts and the trousers, wear socks so that we protect ourselves from the mosquito bite. The cure again is the obstructed lymphatics is diverted to the veins. The other significant cause of lymphedema is cancer surgeries. The cancer surgeries remove the lymph nodes. And why that is done? Because all the solid cancers like cancer of the breast, cancer of the genitalia, external genitalia, cervix, uterus, ovaries, all these spread through the lymph nodes. So in order to make sure that the cancer does not come back, one has to remove the lymph nodes to save the life. And if that happens, the side effect of such surgeries are the fluid accumulation, and again the treatment is the bypass shunt. The third important cause for this lymphedema is it can happen from birth because of less development of lymphatic system. Sometimes it manifests after birth, sometimes it manifests in teenagers, and sometimes it manifests in adulthood after age of 35 years. A series of investigations like lymphoscintigraphy is done, and once the diagnosis of lymphedema is achieved, we can undergo surgery. Remember, if you do the surgery early, the chances of cure is very high, and in the later stages, obviously the chances of cure are less, but we can definitely reduce the swelling and control the disease in most of the patients. You can write to us at mumbailymphedemacenter@gmail.com. Our website is www.mumbailymphedemacenter. Please comment on this video and give your suggestions. Thank you so much.